This was a 34-day-old infant who fell from a chair. On the initial CT scan, one can see that the patient has had significant soft tissue injury to the scalp. Not only that, but off the soft tissue windows, one can already see that the patient has had a fracture of the calvarium. This is at the coup side of the injury. You notice that there is subarachnoid blood products which are accumulating under the fracture site, and there's also an extraaxial subdural hematoma appearing. If you look contra coup, you see that there is an extraaxial collection overlying the temporal region, and this has mixed density, likely from acute bleeding with unclotted blood. You also see that the patient has some blood products that are accumulating at the top of the tentorium near the pineal region. The patient was scanned serially, but before that, I want to make one point about fractures in the infant. We have found that creating three-dimensional reconstructions of the calvarium have been infinitely valuable in detecting fractures. This is a 3D reconstruction from the bone thin section images, which were 0.75 millimeters thick. As you can see, it well demonstrates the wide fracture that occurred in this patient that communicated with the superior sagittal suture. There also was a fracture which crossed the midline on the right side, and you can also see an additional fracture of the calvarium which extends to the lambdoid suture. Therefore, I highly recommend that one takes the thin section images and reconstructs them in a three-dimensional fashion to look at the calvarium for fractures in infants. It really does show it well. Now let's see the patient's 6-hour follow-up scan. The patient continues to show the soft tissue swelling and continues to show a small amount of subarachnoid blood and extraaxial collection under the fracture site. There is more blood product which is seen at the tentorial incisura, that is the top of the tentorium along the superior vermis. And one continues to see an extraaxial collection which looks a little bit larger, more posteriorly on the right side, again with mixed density suggesting that this may be unclotted blood that is still bleeding currently. You notice also a new area of hemorrhage in the cortical surface of the medial aspect of the left frontal lobe. Let's see the patient's MRI scan. This is the MRI scan of the patient 4 days later. It shows continued swelling of the soft tissues of the scalp, as well as the fracture site and blood products underlying the fracture site on the right side. We continue to see the hemorrhagic collection in the right temporal region as well, and it doesn't look like there's very much in the way of midline shift. The patient is doing much worse than one would expect, however, from this degree of imaging findings on the T2 weighted scan. Before I show the susceptibility weighted scan, which is usually the money scan, I do want to show the diffusion weighted scan. As I said previously, shearing injuries can lead to cytotoxic edema that is seen within the white matter. This is the trace image of the diffusion weighted imaging, and almost immediately you can see that there are areas of high signal intensity along the gyrus rectus region, in the subcortical white matter of the right posterior temporal lobe extending to the occipital lobe, in the frontal lobe on the left side, and in the high right frontal lobe and parietal lobe. So these are areas where the brain has been damaged in a setting of diffuse axonal injury. The DWI shows the cytotoxic edema. However, The susceptibility weighted scans will show the degree of hemorrhage. Unfortunately, the patient was moving quite a bit. However, I hope that this scan can still impress you with the amount and number of hemorrhagic injuries to the brain from the shearing injury that the child sustained. We tried it multiple times. You see all these little black areas which represent the deoxyhemoglobin of hemorrhagic shearing injury. In this patient, 2 CT scan and initial Fastman Echo T2 weighted scans were relatively unrevealing. This is the T1 weighted scan showing small extraaxial fluid collections. So once again, diffuse axonal injury can occur not just in adults, but can occur in children and may be associated with devastating consequences.